welcome back to HealthCare Consumerism Radio. This is your host, Brent Macy, joined here today with my co-host, Jonathan Field. And we would actually like to welcome Dennis McGuire, who is the CEO with CodeBaby, to the show. Welcome, Dennis.
Good morning. How are you?
Oh, doing great. How are you today?
Oh, we're doing great. We've got a beautiful Colorado morning here.
Oh, that's great. Well, thank you for joining us on the program. And I know you guys, you're in the wild world of the healthcare space and doing some unique things around what you're doing with CodeBaby. Tell our audience a little bit about CodeBaby, and we'll get into some more information following that.
Sure. CodeBaby is a technology provider that's focusing in the self-service space, particularly with how to create and use different tools to build is optimal of an online customer experience as possible. And we've got some unique capabilities that we bring to the marketplace that really helps drive consumer engagement and allows the customer to really self-service to the highest degree possible based on the channels they want to interact with. So we're very excited about some of the things going on in the healthcare space and look forward to talking about it.
Yeah, and I think, when we look at the market out there, you got a lot of need for communicating to the employee population about specific moving pieces to a lot of different things. And I know there's a big need for virtual assistants, in the benefits enrollment space. Can you kind of elaborate on what you guys saw and the niche you really fill with your tools for, let's say, an employer?
Mm-hmm. Well, a couple of things. As you're aware, the consumer is more and more in control of how they want to interact with brands, and what that's forcing large companies to do is to make sure that regardless of the channel that the consumer or the employee wants to interact with, they're in control of their experience. And so that's driving the growth in this virtual assistant space. And so particularly when you look at the healthcare environment where you have very complex products and concepts that you need to communicate, being online and allowing the consumer to really at their own pace absorb the information, do different product comparisons, and have better decision support tools is really been critical. And obviously with 30 million new consumers coming into the healthcare space, there's a lot of challenges there that the big healthcare providers are needing to address, whether that's multilingual needs, just the reality that with that many new consumers coming into space, they can't absorb that from a pure customer service perspective. So they're having to look at interesting new tools and technologies to help with that assistance moving through a comparison enrollment process as the next year rolls out.
Now, there's a lot of different ways that you're going to have that an employer, or let's say, for instance, or whether it's a health plan, they're going to have to communicate to either their members or their employee population. So are there multiple different ways these virtual assistants can really communicate to those populations, whether it be display, speech? You mentioned bilingual, so are there different avenues that need to be rolled out to either the member or the employee population?
There sure are, and when we work with our customers, the first thing we really sit down and discuss with them is what's the biggest concern they have? What are they trying to accomplish from an online perspective? And so that we're building the appropriate engagement model based on those objectives, and that then brings into I think what you were alluding to is customers engage with many different form factors, whether they're on a computer versus a potential tablet experience, and then ultimately a smartphone type of experience. And each of those online engagement models might be different. So you may use a virtual assistant, meaning a 3D animated character who can guide you through a complex process on your laptop. and that may be appropriate on a tablet, but you wouldn't want to use that same experience on a smartphone. So you're going to design different interactive experiences based on those form factors. And then, again, based on what you're trying to accomplish, you may have a simple Q&A kind of requirement, in which case that's a pretty easy model interacting with a natural language knowledge base or other tools of that requirement. If you're doing something more complex like product selection and comparison within the enrollment process, then you're going to have a more complex experience model where you use this 3D animated character to help basically take the role of as much as possible of a customer service person. So you create a bidirectional conversation model to really help that consumer get the information that they're looking for.
I think, and we've talked about it on multiple programs here on IHC Radio, is the emergence of these private and public exchanges. The public exchange, we understand that will get up and rolling, but the private exchanges are moving a little bit ahead of those. Do you see a role for your solutions inside of whether it be the private exchanges that are rolling out across the country or even the public exchanges?
Yeah, actually, we are working in both spaces at this time, and on the private side, obviously you're seeing we're seeing our clients trying to build different experiential models to really differentiate themselves in the marketplaces that they serve. So you can imagine the challenges of needing to have the highest level of service, again, as many channel options as of how the consumer might want to engage with you. And then when they do choose that channel, what's the best experience? Where are they in control of their experience? Where are they getting the quality information at the level they want, in the language they want? And so obviously we're seeing that need of being able to take someone through, we often call it a guided tour or an experience stream where someone comes in and based on what they want to accomplish, a virtual assistant can guide them through the process and be there when they need help and allow that consumer to compare products, to understand their particular needs, and then what products best fit that need. And so that has a huge opportunity to differentiate themselves against their competitors in the private exchange world. And then obviously with on the state side of things, as you have 30 million new consumers coming in, there's a lot of unique challenges these state exchanges are going to have. Multilingual, as I've alluded to, but just the uneducated potential new healthcare consumer and all of the challenges they may have on becoming more and more educated on what might be the best solution for them.
I couldn't agree more. I think, we look at the market and we all deal with this, every day, and the healthcare space is still kind of confusing to us, and now we're going to put 30 million new people into the system and flip a switch and tell them, hey, go ahead. And they're going to kind of put their arms up and say, what do you mean? So from a communication standpoint, I think you guys fit very well to communicate that to the marketplace.
Absolutely. Simple concept of what's a defined contribution plan versus a defined benefit plan, and what does that mean to me, and how are they different, and what are my options under each, right? You can imagine if every new consumer has to pick up the phone and call into customer service, and you end up with a 20 or 30-minute phone call when a lot of that can be handled elegantly online with a virtual assistant experience.
Yeah, we looked at the exchanges and said, that this is a game changer in the market and the way everything's going to be delivered. But you're going to have people who don't exist in the exchanges. They're going to continue to do, what they've done. They might modify a lot of different things. Where do you see virtual assistants evolving over the next, let's say, 2 to 5 years as we get, full steam ahead in the implementation of the healthcare law and some other aspects?
Yeah, I think as the adoption of virtual assistants become kind of the norm, And I think with the changes healthcare is seeing that they'll actually be one of the leading verticals to drive some of the newer innovations because they have so many new demands being put upon them with the new legislation. But we see literally the technology evolving in the next 2 to 3 years to where you're able to build sophisticated models that basically create a real-time experience so that you can imagine asking a question to a virtual assistant, whether it be speech recognition or, again, just typing in or interacting with the character to tell them what you're interested in. And based on that, the virtual assistant rendering real-time in the cloud and delivering the answers that are appropriate for what the input was from the consumer. So you literally get to the point where you're modeling as close to a human interaction as possible based on the preconditioned scripting and solutions you want to provide to the consumer from their inputs. And so, you're never going to replace the human customer service person in total, but I think the technology will migrate to the point where it is as close to a real-time experience as you can do with technology.
Now, Dennis, is there, just for our audience, is there certain channels that you work through, whether you've got an offering for an employer, for a health plan, brokers, consultants, is there an interest from them in your solution? Where do you where are your channel partners that you look to serve?
Yeah, well, basically, we kind of see ourselves as a digital strategy expert, right? Okay. So when you think of, it doesn't matter what your objective is online, we can build a solution that addresses that challenge. So we actually can build full integrated solutions. So when you think of an enterprise, we could be part of the marketing program. And so some of our customers are literally branding their organization with some of our 3D characters, and so they become part of demand generation cycle on the front end, flowing all the way through, response management of that from those campaigns, and then leading them through the product education and enrollment process. So our virtual assistant experiences are literally guiding them through the complexity of the enrollment forms, the signing up for HSA programs, all that data capture, guiding people through so that they don't abandon themselves while they're online and have to default to a phone call. So I guess the bottom line is we look at the problem with our customers and then craft a specific solution to address that. So it's not a canned solution. It's very custom to what our customers are trying to achieve online.
Now, as we wrap up this segment, Dennis, kind of give us 2 or 3 different takeaways for our audience to really understand you, and then let them know how they can find you guys.
Yeah, absolutely. I think the couple of key things is that the high level, which I mentioned earlier, is that realizing the consumer's in charge and that one solution doesn't fit all. So you have to look at all the different ways your customers can possibly engage with you and how do we create the best experience based on that, whether, again, it is through traditional contact channels, so the customer service, call center side of it, and how does that integrate into online tools? How do you cultivate a relationship? Are there product education needs versus just online conversion needs, and how to optimize that across different form factors, knowing that you can use many different channels or many different solutions, and there's not one particular virtual assistant experience that will solve all issues. And so flexibility and really understanding what your customer needs are is probably the top most critical thing you can do.
Well, thank you so much for joining us today, Dennis. We really appreciate it. Now, to our audience, CodeBaby is a corporate member of the Institute for HealthCare Consumerism, and you can find their information on our website. Dennis, your website, if they want to find you?
It is www.codebaby.com.
All right. Well, thank you so much for your time, Dennis. And to everybody else, we'll be back with our second segment of HealthCare Consumerism Radio. Thank you.
Thank you.
Did you miss a show that you really wanted to hear? All of our programs are available